In preparing for sport-specific activity, skating and dryland, it's important to get the muscles around the hip activated. This first exercise is hip extension, and it's part of the 4-way hip series. This can be completed with your knee straight or your knee bent. A lot of the stability of where the knee goes actually comes from the hip. So good activation of the hip will help you control your knee while you're doing dryland and skating. The second exercise of 4-way hip is when you lay on your side. And for the top leg, this is hip abduction. So lifting your leg up. Your upper body can be up on your elbow or you can be laying down. And you're really looking at getting that glute med. So gluteus medius is the muscle. If you put your hands on your hips, the thumb will find it on the outside of that hip. For the third exercise, you're looking at adduction. So from here, you can stay on the same side, cross over the top leg, and now you're lifting the bottom leg, activating your adductors. Your adductors and your glutes work together to control the rotation of the hip, which again helps control the knee. And then the fourth exercise of 4-way hip, laying on your back, one knee bent, foot flat on the ground, and then lifting up the opposite leg. All of these exercises, you can add a band or some kind of weight to make it more difficult. Doing 10 to 15 reps of each exercise for each hip. Monster walks are a great exercise for, again, hip strengthening and hip activation. Coming into a lower, or for skating, a higher squat position, the band can be around your knees or your ankles, and really using the glutes and the hip to push the band out as you step forward and as you step back. This will help activate the hips, help with control, wanting to stay with control as you step, doing about 10 steps per side. Quadruped fire hydrants is the last exercise in this series, and you'll start in a tabletop or quadruped position, so hands and knees, and bringing one side at a time up and out to the side. This is another glute med activation, looking at control of what the hip is doing, and then we get a little bit of core activation as well, as you want to keep your upper body nice and stable and core activated as you move through this motion, 10 to 15 on each side.